The powerhouse within, an introduction to the female reproductive system. The female reproductive system is a complex and fascinating part of human anatomy. The female reproductive system is a remarkable and intricate part of the human body. It plays a crucial role in the continuation of life and is essential for reproduction. It's a series of organs working together to make babies, also known as reproduction. These organs include the ovaries, fallopian tubes, uterus, and vagina, each playing a vital role in the reproductive process. This system is responsible for producing eggs, carrying a pregnancy, and giving birth. The ovaries produce eggs, which travel through the fallopian tubes to the uterus, where a fertilized egg can develop into a fetus. Understanding how this system works is key to a woman's overall health. Regular checkups with a gynecologist can help monitor and maintain reproductive health. This guide will break down the female reproductive system in a clear and simple way. We'll cover the functions of each organ and how they work together to support reproduction. We'll explore both the external parts you can see and the internal parts hidden inside. The external parts include the vulva, while the internal parts include the ovaries, fallopian tubes, uterus, and vagina. Learning about your body can help you make informed decisions about your health. Knowledge of the reproductive system empowers women to take charge of their reproductive health and make choices that are best for their well-being. A look from the outside, unveiling the external anatomy. Let's start with the parts of the female reproductive system that are visible. The external genitalia. These organs play important roles in sexual function and reproduction. The vulva, a protective gateway. The vulva is the name for the entire outer area of the female genitalia. This area includes the mons pubis, labia majora, labia minora, clitoris, and vaginal opening. The vulva acts as a protective barrier for the internal reproductive organs. The clitoris, a beacon of pleasure. The clitoris is a small, sensitive organ located at the top of the vulva. It's covered by a fold of skin called the clitoral hood. The clitoris is packed with nerve endings and is responsible for sexual pleasure. The labia, guardians of sensitivity. The labia are folds of skin that surround and protect the vaginal opening. The labia majora are the outer, larger folds, while the labia minora are the inner, smaller folds. Both sets of labia are sensitive and contribute to sexual arousal. Section 3. Journey to the core. Exploring the internal anatomy. Now, let's delve into the internal organs of the female reproductive system. These organs are located in the pelvic cavity and are essential for reproduction. The ovaries, tiny factories of life. The ovaries are two small, almond-shaped organs located on either side of the uterus. They are responsible for producing eggs or ova and the female hormones estrogen and progesterone. These hormones are vital for sexual development and regulating the menstrual cycle. Section 4. The fallopian tubes, delicate bridges of hope. The fallopian tubes are thin, tube-like structures that connect the ovaries to the uterus. Their primary function is to transport eggs from the ovaries to the uterus. Fertilization, the meeting of an egg and sperm, typically occurs in the fallopian tubes. The uterus, a nurturing cradle for potential. The uterus, often referred to as the womb, is a pear-shaped organ located in the pelvic cavity. Its main function is to nourish and protect a developing fetus during pregnancy. The lining of the uterus, called the endometrium, thickens each month in preparation for a possible pregnancy. Section 5. The cervix, a powerful gateway between worlds. The cervix is the lower, narrow part of the uterus that connects to the vagina. It acts as a gateway between the uterus and the vagina. The cervix produces cervical mucus, which changes in consistency throughout the menstrual cycle to either aid or prevent sperm from reaching the egg. The vagina, a canal of strength and sensation. The vagina is a muscular, elastic canal that extends from the cervix to the outside of the body. It serves as the passageway for menstrual blood to leave the body. It's also the receptacle for the penis during sexual intercourse and the birth canal during childbirth. Section 6. The menstrual cycle, a symphony of hormones and renewal. It is a complex and beautifully orchestrated process that plays a crucial role in a woman's reproductive health. The menstrual cycle is a series of hormonal changes that occur in a woman's body each month to prepare for a possible pregnancy. These changes are regulated by intricate interactions between the brain, ovaries, and uterus. It typically lasts between 21 and 35 days, with the average cycle being 28 days. This cycle can vary greatly from woman to woman and can even change over time for the same individual. The cycle is divided into phases: the follicular phase, ovulation, the luteal phase, and menstruation. Each phase has its own unique characteristics and functions. During the follicular phase, the lining of the uterus thickens, preparing to potentially support a fertilized egg, and an egg matures in one of the ovaries. This maturation process is driven by the hormone follicle-stimulating hormone, or FSH. Ovulation is the release of the mature egg from the ovary, a critical event in the menstrual cycle, usually around day 14 of the cycle. This timing can vary, but it is often considered the midpoint of the cycle. The luteal phase follows ovulation, characterized by the secretion of progesterone, during which the empty follicle in the ovary produces progesterone. This hormone helps maintain the thickened uterine lining. If fertilization doesn't occur, hormone levels drop, and the uterine lining sheds, resulting in menstruation. This marks the beginning of a new cycle, a continuous process of renewal and preparation. Section 7. The role of hormones, estrogen, progesterone, and their influence. The menstrual cycle and the female reproductive system are primarily regulated by two key hormones, estrogen and progesterone. Estrogen is responsible for the development of female sexual characteristics, such as breast growth and the regulation of the menstrual cycle. Progesterone, on the other hand, prepares the uterus for pregnancy by thickening the uterine lining. It also plays a role in maintaining pregnancy if fertilization occurs. These hormones work in a delicate balance to ensure the proper functioning of the female reproductive system. Menopause marks the end of a woman's reproductive years. It's a natural biological process that typically occurs between the ages of 45 and 55. During menopause, the ovaries gradually stop producing estrogen and progesterone, leading to the cessation of menstruation. Menopause can bring about various physical and emotional changes, such as hot flashes, night sweats, vaginal dryness, and mood swings. These changes are a result of hormonal fluctuations. It's important to remember that menopause is a normal part of aging. Like any other part of the body, the female reproductive system can experience health issues. Some common gynecological problems include menstrual irregularities, which can include anything from unusually heavy or painful periods to missed periods. Uterine fibroids, which are non-cancerous growths in the uterus that can cause pain, bleeding, and other problems. Endometriosis, a condition where the tissue that lines the uterus grows outside of it, causing pain, infertility, and other issues. Polycystic ovary syndrome, or PCOS, a hormonal disorder that can cause irregular periods, acne, and excess hair growth. It's crucial to pay attention to your body and seek medical attention if you experience any unusual symptoms. Early detection and treatment are essential for maintaining good reproductive health. Regular checkups with a gynecologist can help catch these issues early. Don't hesitate to discuss any concerns with your healthcare provider. They can offer guidance, run necessary tests, and provide treatment options tailored to your needs. Remember, taking charge of your reproductive health is a vital part of your overall well-being. By staying informed and proactive, you can address concerns before they become serious problems. Your health is worth the effort. Regular gynecological checkups are essential for all women, regardless of their age or sexual activity. These visits allow healthcare providers to screen for potential problems, provide preventative care, and address any concerns you may have. A typical checkup may include a pelvic exam, pap smear to screen for cervical cancer, breast exam, and discussion about your medical history and any symptoms you're experiencing. It's essential to feel comfortable discussing your reproductive health with your doctor. Understanding the female reproductive system is empowering. By learning about how your body works, you can make informed decisions about your health, seek appropriate care when needed, and embrace your body with confidence. Remember, knowledge is power. The more you know about your body, the better equipped you are to take care of yourself and live a healthy and fulfilling life.